Hi everyone, it's Jasmine, and today's video is all about macular degeneration and how we can protect our eye health. So I hope you learned something in today's video, and let's get started. Now, what is macular degeneration? Macular degeneration is a progressive eye disease that affects the macula, which is the central part of the retina. Macular degeneration leads to loss of central vision, difficulty reading, recognizing faces, or driving. And it's the most common cause of vision loss in adults over the age of 50. Now, if we kind of review the anatomy of the eye, we have the retina, which is the light-sensitive tissue at the very back of the eye, and then the macula, which is a small central area that's responsible for sharp central vision. Damage to the macula, as a result, will cause blurry or dark central vision. So now there are two ways that one can acquire age-related macular degeneration, both of which cause damage to the macula, which we just reviewed. Now there's dry age-related macular degeneration, otherwise known as AMD, which is 80 to 90% of macular degeneration cases. It results in gradual thinning of the macula and the presence of drusen, which is yellow deposit on the eye. Then we have wet AMD, which is responsible for the remaining 10 to 20% of macular degeneration cases. And this is where abnormal blood vessels grow underneath the retina. This results in rapid vision loss if left untreated. Now, there are a number of risk factors that increase one's probability of acquiring macular degeneration, one being your age over 50 years old, having a family history of macular degeneration, smoking, having a history of obesity or eating a poor diet, having cardiovascular disease and high blood pressure, and sometimes light eye color can actually slightly increase your risk as well. Some symptoms of macular degeneration include blurry or distorted central vision. Straight lines can appear actually wavy. You can have difficulty reading and seeing faces. There can be dark or empty areas in your vision, and there can, as a result, be an increased need for bright light. To diagnose macular degeneration, it's really important that we're having comprehensive eye exams done. This can include visual acuity tests, Amsler grid testing for distortion, optical coherence tomography for retinal imaging, and then angiography can actually detect the wet AMD. To review, Amsler grid testing is a simple visual test where a patient looks at a grid of straight lines to detect if any looked distorted or wavy. Optical coherence tomography is a non-invasive imaging technique that uses light waves to create detailed cross-sectional images of the retina, which can allow clinicians to assess the thickness of the retina, if any fluid has accumulated, or if any of the structures have changed. And then when we look at the angiography is a diagnostic procedure which uses fluorescent dye, which is injected into a vein and photographed as it travels through the retinal blood vessels to identify if there's any areas where there's leakage, blockage, or abnormal vessel growth. Now, there are some treatment options that do exist. If for dry AMD being the one that causes typically 80 to 90% of macular degeneration cases, there are nutritional supplements and then really important lifestyle modifications. So if you smoke, getting support in stopping smoking and adopting diets that are rich in leafy greens, fish, antioxidants, omega-3s. For wet AMD, the anti-VEGF injections can be a treatment option, or laser therapy in select cases. Essentially, for the injections, they are medications that are injected directly into the eye, and they block a growth factor, which is usually involved in promoting abnormal blood vessel growth and leakage. Now, again, we kind of just discussed this in treatment options, but different behaviors can be adopted for prevention and lifestyle. These can include smoking cessation, eating a healthy diet that's filled with leafy greens, colorful fruits, omega-3 fatty acids, and so on. Making sure that we're having regular eye exams done, controlling our blood pressure and our cardiovascular health, and protecting our eyes from UV light. So making sure we're using glasses when we're getting outside, we're avoiding like tanning beds, any bright lights directly in the eye, and so on. In some, macular degeneration is one of the leading causes of central vision loss in older adults and primarily affects the macula, the part of the retina responsible for sharp, detailed vision. While it does not typically cause total blindness, it can significantly impact daily activities such as reading, driving, and recognizing faces. Early detection is especially important, particularly for wet AMD, which can progress rapidly, but it's often treatable if it's caught early. Although there's no cure, treatments, lifestyle changes, and nutritional support can help slow disease progression and preserve your vision. Regular eye exams, managing overall health, and monitoring for vision changes are essential for maintaining eye health and quality of life. Thanks for watching.